As more vaccines go out to more people and more reopens, it feels like we're getting closer and closer to a sense of normalcy. But experts say now is not the time to let up being cautious. So we know there are still more questions to be answered about all things coronavirus. From how to get a shot, where to sign up, reactions, and the virus itself. So tonight, we present to you We Together, a coronavirus discussion.
And thank you for joining us for this coronavirus special discussion. I'm Brooke, Lennington. For the last 4 months, we've been bringing in local experts to answer all of your burning questions about coronavirus. And joining us tonight is Dr. Cliff Jones and Carol Perry, both with Topeka's Stormont Vail Hospital. And I want to thank you both for being here with us tonight. Now, before we get to our questions, we do want to quickly go over some numbers. So we are currently in phase 5 in Kansas, meaning anyone 16 and older can sign up for a vaccine. And with that, the state's health department says that more than 1.7 million doses have gone out across the state, and over 1.3 million vaccines have been administered in the state, with 895,000 people in Kansas receiving at least their first dose, which makes up nearly 31% of people living in the state. So now, before we check in with our guest in the studio tonight, Stormont Vail Hospital in Topeka is a part of the Mayo Clinic Care Network in Minnesota, meaning that the hospital works hand in hand with Mayo as partners. And my co-anchor Molly Patt got a chance to talk with Dr. Richard Kennedy from the clinic earlier, who is a part of the vaccine research group. And here's their conversation.
All right, Brooke, thanks. We are super excited because joining us all the way from Minnesota today is Dr. Richard Kennedy, who works at the Mayo Clinic, which Stormont Vail has a big relationship and partnership with. So thank you so much for taking the time to talk with us today, Dr. Kennedy.
Pleasure. Thank you for inviting me onto the program.
Yeah, so first let's just briefly talk about what you do and specifically what has been your biggest role in the pandemic.
So my lab studies immune responses to viral vaccines, primarily respiratory viruses. And we like to try and understand why people have such a very different response to vaccines. Everyone is unique and their immune systems are exactly the same way. So everyone responds slightly differently. And we try and understand how genetics and race and age and nutrition and other factors such as those play a role in how you respond to a vaccine.
Yeah, so you're very important for us right now. So on the front of vaccines here in Kansas, anybody 16 and older can now sign up for an appointment to get a shot. Some people are actually wanting to wait until they can pick a specific brand of vaccine that they want. So what would you say to those people?
I would say your best bet is to get the vaccine that's available to you now. Right now, there's no information, reliable information telling us which vaccine is better, and better really depends on what you need. Some people aren't available for 2 doses. Some people may be allergic to some of the ingredients in an mRNA vaccine. And so obviously a Johnson & Johnson vaccine is better for them. So I would suggest that right now, if you haven't been infected, you have 0 protection. So any vaccine is better than no vaccine.
Absolutely. And so specifically talking about the Johnson & Johnson vaccine now, a viewer, George Bales, wrote to us asking, is it true that there is fetal tissue in the Johnson & Johnson vaccine? So I want you to talk about what's in that vaccine, the newest one to come up, and maybe clear up some misconceptions that the vaccine or any vaccine can impact fertility.
Sure. So that vaccine does not have any fetal tissue in it. Now, it's a virus, and that virus was grown in cells that were derived from a fetus. So sometimes that matters for people, sometimes that does not. But the vaccine itself doesn't contain any fetal tissue. That vaccine has a virus that's been inactivated. Basically, they turned this virus into a Trojan horse. And so it can infect one and only one cell. It carries with it the gene for the spike protein. And so it will enter that cell and tell the cell to create the spike protein from the SARS-CoV-2 virus. And then your immune response will then recognize that viral protein and learn to attack it. So it doesn't have, there's no data suggesting that it has any effect on an unborn fetus, that it's dangerous for pregnant women. And so I think by and large, when you talk to anybody in the medical community and the healthcare providers, their suggestion is go ahead and get the vaccine. There's no data showing that it's dangerous, and there's a wealth of data showing that it is protective.
Good. So there is really just no need for that misconception and people to be worried who are trying to get pregnant about it impacting them being able to get pregnant.
Correct.
Okay. And so also you mentioned that it's made from a virus. Talk about, some people with the flu shot, for example, are nervous to get the flu shot because they say that they're going to get the flu or it gives them the flu. So kind of talk about, is that the same thing for the COVID vaccine, and to ease people's minds about that too?
The shot, that's what I'm talking about right now. It does not have any live virus. It doesn't even have any dead virus. What they do is they grow it in eggs, they inactivate it, and then they use a detergent to break it up into pieces. And then they use some of those pieces in the vaccine. So there's no virus in the influenza vaccine.
Okay.
Where the Moderna and Pfizer are mRNA vaccines, there's no virus in any of those vaccines. The Johnson & Johnson vaccine is based on an adenovirus. That's a virus that causes a mild cold, basically. And what they've done is taken that virus and taken 2 genes out of it so it can no longer grow once it gets in you. And they've inserted an extra gene for the SARS-CoV-2 spike protein. So there is a virus in that vaccine, but it's inactivated. It basically can't, once it infects one cell, that virus is done. It can't do anything else. So there's no chance of infection.
Another viewer question for this one is from Linda Huston. She says, I had COVID-19 and then got the first shot. Do I need the second vaccine? So can you talk about why it's important to see through both doses if that's what the vaccine requires?
We know the vaccine efficacy from the clinical trials is based on data we've gotten from 2 doses. And that's why they're pushing, get the full vaccine regimen. If it's an mRNA vaccine, you need both doses because that's what was tested. That's what we have the data showing that it's effective for. There is more and more data coming out showing that after you're infected, you do have an antibody response. After you get the first dose, you do have a boost in antibody titer. And that boost, you will have more antibody if you've been previously infected after 1 dose than somebody who was never infected who just gets 1 dose. But the recommendation right now is to get both doses to make sure we boost your immune response as high as possible so that you'll be protected for as long as possible.
Yeah, that's great. Now I want to talk about herd immunity as well. Is that a possibility? And can you explain what that would do for protection or if it's even possible?
Sure. So early on in the pandemic, we were guessing that herd immunity would, well, let me start with the concept of herd immunity. The idea is that viruses have to transmit from person to person. If anything that disrupts that transmission can stop an outbreak. There's 2 ways to do that. You take the people and spread them apart so they can't transmit the virus, or you put an obstacle in the way, such as protective immunity. So if a virus gets into somebody and there's no protection, they can cause disease and spread. If they get into somebody that has an immune response that kills the virus, it's done. It can no longer spread. And so if you get enough people with protective levels of immunity, then it is more and more difficult for the virus to find a host that it can infect and then jump to new people. Early on in the pandemic, we thought that the number of people, the percentage of the population we would need to have protection was 60 to 70%. As we've learned more about this virus, that estimate, which is still all it is an estimate, keeps going up. So now it's probably in the 70 to 80% range. And again, that's just our best guess right now. That would mean that 70 to 80% of the people would need to be fully vaccinated and protected against the disease before we start seeing a decrease in cases. I will point out that Israel's vaccinated about 70% of their population with the Pfizer vaccine, and we're already starting to see a huge decrease in the number of cases.
That's great. Okay, so that we also know that a big treatment with Stormont and Mayo is through the plasma donations, and that helps people who are severely ill with coronavirus. So let's say you have antibodies, you've been donating plasma to help. Once you get the vaccine, can you still donate, or does getting the vaccine hurt that treatment option for people?
No, in fact, it would increase the amount of antibodies that you have that can fight the disease. And so right now I don't think any recommendation not to continue donating after you get vaccinated.
That's great. So keep donating even once you get vaccinated, for sure. Okay, so then it also seems crazy that it's springtime already and we haven't talked about the flu nearly at all. It's like we totally skipped over flu season. So can you explain why that happened and if it could be that way in the future as well?
Things that we're asking people to do to fight COVID-19, that's the masking, the social distancing, the limit interactions as much as possible, wash your hands often, use hand sanitizer. Those work against all respiratory pathogens. And so not only are we seeing a decrease in COVID-19 when people follow these guidelines, we're also seeing a huge decrease in influenza. So that's sort of a side benefit that's initially been overlooked. And so, yes, we would continue to see that in future flu seasons if we instituted these same public health policies. We'll see whether or not that happens. But yes, they are very effective against many more viruses than just COVID-19.
Yeah, some good news there. Now, new variants are popping up as we kind of start to feel like the pandemic is easing a little bit, but then these new variants are coming up, so it causes a little bit of concern. So do the current vaccines protect against these, or will the newer versions of vaccines be better for that?
So the answer is yes to both. We know that the current vaccines protect pretty much equally well against some of the variants. There's a little decrease in protection against other variants. The UK variant, the vaccines seem to work just fine against. The South Africa variant and the Brazil variant that have different mutations, those seem to have, the vaccines are slightly less effective, but slightly less effective is still effective and better than not being vaccinated. Many of the companies are working on newer vaccines that are based on the new variants, and those are likely to be more effective against those variants.
And will people who have already gotten the vaccines, will they have to go get boosters to cover those new variants, or what will it mean for people that have already gotten the vaccine?
It's entirely possible that we might at some point need to do that. And that's true for two reasons. One would be the variants. We haven't seen the last of the variants. We will continue to see more and more variants. And some of those variants will have, the vaccines will be even less effective against than what we're seeing now. That's just going to be the way all viruses, RNA viruses, work. The other reason to get booster vaccinations is that we know the immune response wanes over time. We don't know how long protection will last after these vaccines. It's actively being studied, but it might be that we need periodic boosters just to maintain a high level of immune protection.
Definitely makes sense. All right, Dr. Kennedy, thank you so much for being here. We truly appreciate you taking the time to answer all of our questions today.
You're welcome. It was my pleasure.
Hey, and we are going to take a quick break, but when we come back, we'll check in with our guest live in the studio to talk about why the partnership with Mayo is so crucial, how it impacts you, and all things coronavirus as we get to more of your questions.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
I don't want to tell you how to think.
Selling anger and division and hatred, it's almost like selling drugs.
This man is guilty. He needs to be locked up.
The country's become polarized, and so has the media.
I want to give you something to think about.
The Dunlund Report, weeknights at 7, 6 Central on News Nation.
Like so many other issues, the politics has become more important than the problem solving.
Comedians complain about things, they critique things, they don't agree with things and endorse things.
Banfield, weeknights at 10, 9 Central on News Nation.
The COVID vaccine.
Let's talk about it.
Historically, there's a lot of distrust. We get it.
But people of color are disproportionately affected by this virus.
Too many of us are dying.
We are worried about our patients. We are worried about our community.
We've safely taken other vaccines, polio, tetanus, flu.
Now COVID. It is time to stop the spread.
An emergency situation requires an emergency response.
80% of the US population needs to be vaccinated, including people of color.
So when my time came, I took my shot.
I took my shot against COVID.
What about you?
Do it for your family.
Do it for our future.
The COVID vaccine can save your life and the life of your loved ones.
Take your shot for our people.
Welcome back to our coronavirus special discussion, where our goal is to answer all of your questions about this virus.
That's right. So tonight joining us is Dr. Jones and Carol Perry. So thank you both for joining us for another week. We really appreciate it. Now, before we get to our viewer questions, Dr. Jones, can I have you just briefly talk about why your partnership with Mayo Clinic is so valuable after we just heard from Dr. Kennedy?
Well, his presence here with us is an example, and of course it's virtual. In years past, up until about a year ago, we had opportunities for collaboration both on their campuses and on ours. And the levels of collaboration extended from clinical work to administrative and management work, the operations of various service lines. And it's been invaluable, absolutely, and an opportunity to meet and speak with experts from a place like the Mayo Clinic has afforded us and our patients, I think, many opportunities. In addition, it has allowed us to have an individual consultation, electronic consultations that we can provide between our patients and a specialist in whatever field that would seem appropriate at one of the Mayo Clinic campuses. So additional direct service to individual patients when additional information or perspectives are of value.
And Carol, I have a question for you now that comes from a Carol as well, Carol Baldwin. She says that the vaccines are sometimes causing problems with people's lymph nodes. I have friends whose physicians have told them not to have mammograms within 6 to 8 months after receiving the vaccine, as it can result in a false positive. That sounds like a very long time, as well as a possibility for breast cancer diagnosis to be delayed or missed. So do you have any guidance?
I would say, boy, I would draw on experts. I was a high-risk OB nurse, but I would not put off a diagnosis of potential cancer for that long. So from my perspective, I would immediately call my primary care doc or the oncologist, any physician, tell them that you had swollen lymph nodes, but also let them know why you're concerned. Prevention of breast cancer, they're teaching us how to do manual exams, mammograms, all those are preventative. So I wouldn't put it off without talking to a healthcare professional, and 6 months seems like a long time when you're really looking at a timely diagnosis. So I wouldn't say exactly 6 months, but I would definitely not do that without talking to a healthcare professional, your primary care doc, and not put any prevention off without knowing why you would do that.
Yeah, definitely very important. Now, Dr. Jones, we had somebody write into us asking about the administration fee when getting the shot at Stormont Vail. So how much should people expect to pay when they show up, and is it covered by insurance?
It's, to my understanding, the administration fee will be covered by insurance. If it's not, it's also my understanding that the individual receiving the vaccine will not be stuck with having to pay that administration fee. So the vaccine is provided through the federal government programs to us at no cost, but again, the administration costs are significant, and we will submit that to your insurance company if you have health insurance. If you don't, there is a federal program that will allow us to bypass that billing.
And Dr. Jones, Steve Hare also wrote to us saying that he is confused about how vaccines are distributed in Shawnee County. So he says, do all doses coming to Shawnee County go to the health department? Then are they distributed to hospitals, Walmart, or Walgreens, or do they go to each place that is giving shots and bypass the health department? So Dr. Jones, can you just kind of explain that process?
The process, again, to my understanding, is the Kansas Department of Health and Environment is distributing the vaccine received from the federal government to the local health departments, and the local health departments in each county, each jurisdiction will determine how to distribute that, whether some counties have their own vaccination centers or if they rely on others. The pharmaceutical chains, the drugstores, get their allocations directly from the federal government. So in the Shawnee County, there's a Shawnee County Vaccine Collaborative that includes both hospitals, the VA hospital. Also represented are the local pharmacies, but the county health department is the one distributing the vaccines to the vaccination centers at each hospital, including ours.
And Carol, as the Chief Nursing Officer, how is your staff doing? I mean, we're more than a year into this at this point, so how is morale at the hospital, and is there anything that the public can do to help your staff?
Well, I first want to say that the public has been so kind and generous all along for the past year. They have not forgotten what it's like to try to deal with this, the unknown, what staff are doing to come in and take care of them, and so the public and the community has been very kind and generous from the get-go. Morale, I would say, is very good. I think that it's been exhausting, and for many months, you didn't lighten up. And today, when we were talking with our Mayo colleagues, we were sharing back and forth how staff were doing and what we could do to help them. And one of my colleagues said it felt joyous in that you don't have to dread coming to work each day on what you might see. You love taking care of patients, but it was hard to see people so sick and status of their condition change so quickly, and that it was like every day you had to be on your game and there was never a moment to relax. And so I think that staff are happy right now. The numbers have dropped. They don't come feeling like we might not be able to take the next patient. We're at capacity. Patients are waiting in the ED, and so there feels like there's a little bit of relief. We're far from over, but I think they are proud of the way they pulled together, have worked together, what we've accomplished together, and yet feel like they can come to work and take a breather and not know every second what's just around the corner. So I would say that they're in good spirits and feel joyous.
That's good to hear.
Yeah, good to know that things are kind of taking a turn there, of course. And I know that you guys might maybe hear it a lot nowadays, but let us just say we thank you so much for your work that you've done. We've also met quite a few of them as well when gone to get our vaccines at the event center. So definitely can't say thank you enough for everything they've done. But hey, we are going to take another quick break here because we have more questions to get to. We'll be back right after this.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
The COVID vaccine.
Let's talk about it.
Historically, there's a lot of distrust. We get it.
But people of color are disproportionately affected by this virus.
Too many of us are dying.
We are worried about our patients. We are worried about our community.
We've safely taken other vaccines, polio, tetanus, flu.
Now COVID. It is time to stop the spread.
An emergency situation requires an emergency response.
80% of the U.S. population needs to be vaccinated, including people of color.
So when my time came, I took my shot.
I took my shot against COVID.
What about you?
Do it for your family.
Do it for our future.
The COVID vaccine can save your life and the life of your loved ones.
Take your shot for our people.
Save big money in your next project with 11% off everything at Menards. Keep your home dry and protect your belongings this spring with pumps and accessories. Menards has a huge selection of pumps for any application. This half-horsepower utility pump includes the 25-foot hose kit and pumps down to 1/2 inch. Right now, all sump pumps are 11% off. Stop waiting and start saving with 11% off everything now at Menards.
Save big money at Menards.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you. your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
Welcome back to our coronavirus special discussion. We have just a few minutes left, so we want to get right back to it. So Dr. Jones, let's talk variants. How concerned should we be with new variants, and what should we be aware of?
So all viruses mutate or change over time, and COVID-19, the SARS coronavirus 2 itself initiated as a variant from an animal host a year and a half ago. And so that's been happening since the pandemic started. So currently the UK variant is a prominent cause of symptomatic COVID-19 infection in the United States. It does appear, at least in the United Kingdom, it has been shown to be more contagious, and it's possible that it's associated with a more severe illness in some individuals. So that is what's happened. The other variants from other parts of the world have also been observed in lesser populations in the U.S. As we heard earlier, currently our vaccine is active and protective against the major variants that we're exposed to now. Over time, that may change, and it may be in the future that we'll be dealing with different vaccines or boosters similar to what we have in influenza. It is the way it will be with the coronavirus, and we'll just have to wait and see how things develop.
Yeah. Okay, Carol, Julie Smith wants to know about restrictions with getting the COVID vaccine if you have just gotten any other vaccine. So do you have any insight about this, no matter what the vaccine would be that you would have gotten before that?
I don't believe there's any restrictions, and I'm looking at Dr. Jones. He will correct me if that's not true. No, I think the priority is to get the immunization in the arms, and the only restriction would be if they were sick with the upper respiratory, and again, that would be directed by the healthcare professional, the physician, or the provider would give us direction on that.
And Dr. Jones, is there any time restraint from any other vaccine that people should wait on?
Generally, they ask you to try to schedule 14 days between vaccinations, when possible.
And Dr. Jones, another viewer asked us about reactions after getting the vaccine. If you have a response, does that mean that the vaccine is working? And then if you don't, is it the opposite?
So with the exception of severe respiratory distress, such as anaphylaxis, the other reactions, including a sore arm, which should develop within hours or a day or so after vaccination, low-grade fever, fatigue, headache, symptoms like that are your immune response to the vaccine, and it's expected. Everybody's different. The amount of response and reaction that they have will differ. So it's not a certainty that you will have those kinds of reactions. They may be so mild that you don't notice them. Absence of a reaction, if your immune system is healthy, if your health is generally good, I wouldn't worry.
Good to know there.
Yeah, and before we wrap up tonight, what are your key takeaways for both of you, for people watching right now? So one thing you want them to walk away with after watching. So Carol, I'll start with you.
Oh, I think that it's important to know our partnership with Mayo, and that from a Stormont Health perspective, we have a lot of contacts, networking, and colleagues that we can reach out to, and not just to go there or for them to come here, but at a text or at a e-consult, we can get a whole group of people that will really consult on what's the best treatment plan for patients. And I would want to know that if I was being treated, and that I would have experts that Stormont Vail had in partnership. So I love that partnership with Mayo and use it a lot.
Absolutely, yeah, it is a really good partnership and good to know. So Dr. Jones, what about you for a couple sentences of a takeaway tonight?
Well, regarding the Mayo Clinic relationship, we did leverage our relationship with information for how they were handling issues such as PPE and isolation procedures for patients under various circumstances, and trying to get a large academically based source for that information. We have also provided them some opportunities to see how we have managed communication that they've been able to incorporate in the work that they do. So it's a two-way relationship, a collaborative relationship.
Yeah, absolutely. Well, we want to thank you both for joining us for this special discussion tonight. We appreciate your time.
Yeah, we do. And thank you so much for watching this coronavirus special discussion as well. We appreciate you watching too. Have a good night.
La vacuna para COVID. Hablemos al respecto.
Históricamente hay mucha desconfianza, entendemos.
Pero las personas de color son afectadas desproporcionalmente por este virus.
Muchos de nosotros están muriendo. Estamos preocupados por nuestros pacientes. Estamos preocupados por nuestra comunidad.
Hemos sido vacunados contra otras enfermedades como polio, tétanos y la influenza. Ahora COVID. Es hora de detener la propagación. Una situación de emergencia requiere una respuesta de emergencia.
El 80% de la población necesita vacunarse, incluyendo a las personas de color.
Así que cuando llegue el momento, me vacunaré. Yo me vacuné contra el COVID. ¿Y tú?
Hazlo por tu familia. Hazlo por tu futuro. La vacuna contra el COVID puede salvar tu vida y la vida de sus seres queridos.
Vacúnate por los nuestros.